Can itchy armpits be a sign of cancer? Itchy armpits are usually a sign of irritation, infection, or a skin condition such as eczema or dermatitis. Rarely, however, itchy armpits may be a sign of cancer, such as lymphoma or inflammatory breast cancer. This video describes two types of cancer that may cause itchy armpits. We also outline 6 less severe causes of underarm itching, tips on preventing itching, and when to see a doctor. What does it mean when your armpits are itchy? The armpit, also known as the axilla, refers to the underside of the shoulder joint where the shoulder connects to the arm. This area features many different structures such as skin, hair, sweat glands, nerve endings, blood vessels, and lymph nodes. Due to all these structures, in addition to the warmth and dampness of the armpit, it is not uncommon for a person to experience itchy armpits. As it is a sensitive area, people are likely to notice any irritation. Usually, itching can result from inflammation, rashes, infections, or allergies. However, on rare occasions, itching may occur due to a more serious issue such as cancer. Itchy armpits and cancer. Most cases of underarm itching are due to non-cancerous skin conditions. However, lymphomas and inflammatory breast cancer are two types of cancer that may cause underarm itching. Lymphoma. Lymphocytes are white blood cells that help to protect the body from infection and diseases. Lymphoma is cancer that affects these cells. There are many different types of lymphoma. The two main types are Hodgkin lymphoma and non-Hodgkin lymphoma. Itching affects around 33% of people with Hodgkin lymphoma and some 10% of people with non-Hodgkin lymphoma. Itching occurs due to chemicals called cytokines, which irritate nerve endings in the skin. The immune system releases cytokines in response to lymphoma cells. Itching may occur at locations where there are lymph nodes. There are hundreds of lymph nodes at different sites throughout the body, including in the armpits. Other places that may itch include the areas of skin affected by lymphoma and the lower legs. In some cases, itchiness may affect the whole body. Other symptoms of lymphoma include swollen lymph nodes, fever, chills, sweating at night, unexplained weight loss, lack of energy. Inflammatory breast cancer. Inflammatory breast cancer is a rare type of breast cancer that may cause itching of the breast and surrounding areas. Other symptoms of inflammatory breast cancer include a swollen or enlarged breast, a feeling of warmth or heaviness in the breast, pain or tenderness in the breast, skin changes on the breast such as swelling, thickening, or dimpling that resembles orange peel, redness that covers more than a third of the breast, a retracted or inverted nipple. Breast tenderness, warmth, swelling, and itching are often signs of less severe illness such as an infection rather than cancer. In these cases, if there are no other symptoms, a doctor may prescribe a course of antibiotics. If symptoms do not improve within 7 to 10 days of antibiotic treatment, people should return to a doctor who can arrange tests to check for signs of cancer or another condition. Common causes of itchy armpits. The following 6 conditions are more common causes of underarm itching. Intertrigo. Intertrigo is a rash that develops in the folds of the skin. Intertrigo occurs when heat and moisture become trapped between the skin folds, resulting in the growth of yeast, fungi or bacteria. The rash itself is usually red or brown and may itch or burn. Intertrigo commonly develops in the armpits. It may also occur in the following areas: in the crease of the neck, beneath the breasts, beneath the belly, in the groin, between the toes. A doctor may prescribe a topical steroid cream to ease itching and irritation. In severe cases, they may prescribe an antibiotic or antifungal cream to clear the infection. Eczema. The term eczema refers to a group of conditions that cause skin irritation. The most common symptoms are itchiness, color changes, and inflammation. This may occur anywhere on the body. Some people may also find that eczema affects their skin in other ways. Other skin symptoms may include dryness, sensitivity, swelling, oozing, or crusting. Darkened patches, rough, leathery, or scaly patches. Although there is no cure for eczema, some treatments and strategies can help to relieve symptoms and prevent the condition from worsening. People should visit a doctor or dermatologist for a diagnosis and to discuss possible treatments. Irritant contact dermatitis. Irritant contact dermatitis is a type of eczema. Irritant contact dermatitis occurs when the skin comes into contact with an irritant. The condition can develop from a single exposure to a toxic substance or repeated exposure to an irritating substance. Any substance that comes into contact with the underarm area has the potential to irritate. Examples include water, soaps, razors, deodorant, fabric detergent, fabric softener. Itching, burning and stinging are common symptoms of irritant contact dermatitis. In severe cases, the skin may crack and bleed. People who suspect they have irritant contact dermatitis should contact a doctor who will likely prescribe treatments to heal the skin and prevent the condition from worsening. Heat rash. Heat rash, also known as miliaria, is a skin irritation that usually occurs in hot, humid weather. Heat rash occurs when the sweat glands clog up and are unable to release sweat. Water trapped within the glands causes them to swell. This results in a painful itching or prickling sensation. Heat rash usually appears as a cluster of small pimples or blisters. The clusters commonly occur in the armpits and other places where skin touches skin. Areas where heat rash may occur include the neck, beneath the breasts, in the creases of the elbows, around the groin. Heat rash usually resolves once the skin has cooled. Applying cold compresses and wearing loose clothing can ease skin irritation. In some cases, a doctor may prescribe a lotion to help relieve pain and discomfort. Hyperhidrosis. Hyperhidrosis is a condition in which the sweat glands produce an excessive amount of sweat. This condition may affect sweat glands across the entire body or those in specific areas such as the armpits. Although hyperhidrosis can cause embarrassment and discomfort, it is a relatively harmless condition. However, hyperhidrosis increases the risk of fungal infections which can cause underarm itching. Poor hygiene. The armpits are home to many different bacteria. Poor hygiene practices can lead to a buildup of sweat and dirt on the skin, which causes this bacteria to multiply. Excess bacteria lead to odor and an increased risk of infection, which may cause itching as a result. Keeping the underarms clean is important for preventing itchy armpits. Tips for preventing itchy armpits. Many causes of itchy armpits are preventable. The following tips may help prevent bacterial and fungal infections. Keeping the skin cool and dry. Showering after exercise. Drying the underarms thoroughly after showering or bathing. Wearing sleeveless vests or loose-fitting t-shirts. Wearing breathable and absorbent materials such as cotton. The following tips may help alleviate symptoms of underarm eczema. Avoiding soaps and deodorants that contain harsh chemicals. Avoiding shaving with a dry razor. Using a gentle patting motion to dry the skin. Using fabric detergents for babies and people with sensitive skin. Avoiding scented fabric softeners. When to contact a doctor. People should speak with a doctor if they think their underarm itching could be a sign of cancer. Some cancers are more treatable when detected early. People should also consult a doctor if they are concerned about the following: a bacterial or fungal infection, a skin condition such as eczema or dermatitis, persistent heat rash. A doctor will examine the underarm and will prescribe any necessary treatments. In some cases, a doctor may refer the person to a dermatologist for specialist treatment.